is actually a continuation of a clinical presentation that we treated the other day. A patient presented with a chronic pain to the right ankle. The MRI revealed a partial tear of a very important tendon on the side of the ankle. This is the patient that if people may or may not recall, we performed the platelet-rich plasma injection last week. ¿Cuándo fue? 8 days ago. 8 days ago, we performed the platelet-rich plasma injection, and the tendon runs right here. It's called the peroneus brevis tendon. And aside from visualizing degeneration, there was a partial tear of the tendon. So we went ahead and immobilized the area. We did the PRP injection, and talk about a trifecta type, right? Or a bifecta. I also recommended several sessions of low-level shockwave therapy, which is exactly what we're doing today. And again, the reason why we're doing this is to complement everything else, including but not limited to the PRP injection. You know, this is yet another type of regenerative type of treatment that we use for a lot of different clinical presentations. In this particular case, again, a partial tear of a tendon with surrounding degeneration and inflammation. So when we talk about, you know, having the good fortune of having all the tools in the toolbox, this is yet another one of those tools, right, that we're able to use to maximize the patient's improvement and really minimize any long-term complications. I asked the patient this morning, it's only been 8 days, but I did ask her this morning, you know, how is she feeling? And the patient is feeling better. ¿Cuánto mejor usted cree? Antes del procedimiento del plasma rico en plaqueta y hoy. ¿Y tal cual nos pinta el pie también?
Bueno, que yo no lo pinto directamente,
pero con la bota.
Con la bota solo me molesta un poquito.
Un poquito? Okay. You know, the patient is, you know, we do have the patient using a cam walker. Let's show everyone what the cam walker looks like. To really totally immobilize the tendon, right? We don't want any movement. And I want to be very clear with everyone. You know, these treatments are physiological treatments. These are not miracle treatments. And I've said that before many a times. It takes time. It definitely takes time. We're not magicians. If we were magicians, we would probably have our waiting room busting at the seams and patients overflowing to the hallway outside. But that's not the case. But this is yet another phenomenal treatment that we're using a lot here at Jaws Podiatry, whether it's heel pain, plantar fasciitis, Achilles tendonitis, Achilles tendon pain, in this case any type of tendon pain, peroneus brevis, anything related to the soft tissue, patients that have suffered acute chronic ankle sprains, you name it. We're very, very crafty when it comes to the use of low-level shockwave therapy. I know for a fact that at least here in South Florida, not a lot of clinicians or physicians from all subspecialties, they do not have this machine because the machine is expensive, but we really want to provide the best of the best to all of our patients that come see us, and of course the entire community. Make these treatments accessible. We're just going to bump up the frequency a little bit as everyone can hear it now. And we're almost done here. Another couple of shocks. No pun intended. To end this on a grand finale on a bang. We have the good fortune, I think, in closing, we have the good fortune of having a low-level shockwave therapy machine here at Jaws Podiatry. I think it's important for the entire world to know that there are non-invasive alternatives, right? I can say with certainty that probably, I don't know exactly what percent, but there is a percent of doctors that would probably, read the MRI and say, you have a partial tear of this tendon, we have to surgically repair it. And I can definitely say that there's, I don't know exactly, again, I don't want to throw numbers, but there would be a percent of those doctors that would definitely recommend surgery. There is no need for that, as we're historically, and obviously in this particular case, we're finding out that even after 8 days, there is already some degree of improvement. We just have to follow the protocol. The patient needs to continue to do what she's doing to make sure that we follow all the necessary recommendations to make sure that the outcome is something positive. Like always, www.jawspodiatry.com, Instagram, Dr. Tojan, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. I hope everyone has enjoyed this video. The next one